focus of my research actually has been in the last few years on the biological materials, and these materials are used in the sling surgery, which is designed for treatment of urinary incontinence in both in men and women. And we did a animal model research way back in 2010, and we used about 64 mice, and actually we tested different types of biological materials, which included the xenograft, which is a source of the animal tissue. We also tested allograft from human cadavers. We also tested the patient's own autologous materials, and we're trying to find really what is the best material to be used in the sling surgery. So my interest was trying to find really what is the best biological material which would be very efficacious as well as is durable in the long run. We started using and trying to find really the best material, since we are going back to the use of biological material in these patients. And that's probably what's the biggest change is, because in the last decade there was a push both by the industry as well as by the patients to use minimally invasive procedures for the treatment of stress urinary incontinence in both men and women. But because of what we saw over time, that there could be a potential complications and potential issues with the use of mesh. That's why what is changing is actually going back to the more of an old-fashioned or historical procedures for the stress incontinence. My other area of research has been post-prostatectomy incontinence in men following the radical prostatectomy or the treatment for prostate cancer in patients who are diagnosed with prostate cancer. The excitement part of that is actually also using a biological material in those patients who have gone multiple surgeries for their urinary incontinence, because some of these patients, they do develop a severe urinary incontinence following the radical prostatectomy procedures for prostate cancer. And I've been using the dermal grafts in these patients because some of them actually have multiple procedures done in the past, and it makes it very technically difficult, and as well as because of the urethral atrophy they developed. So there is really no good option for them without using a dermal graft, and I think that we have instituted at Mass General Hospital, and I have performed few procedures using a dermal graft in those patients.